Hi, welcome back. We're still in week 4 and we're moving on to module 8, where we will evaluate methods of data capture and management. We have 2 learning objectives for this module. The first is to describe methods of data capture and data management, and the second learning objective is to evaluate methods of data capture and management. So if we describe data capture, this would be data entry. So think about typing things on a keyboard into a web form or a system. And then we have more systematic processes, maybe an API, which is an application programming interface, a web service, a systematic extraction of data from one system, transformation of that data, and then a load into another system. And this method typically happens behind the scenes in an IT information technology function. And then we can have data capture that comes from barcodes, QR codes. These are used a lot for scanning medication for inpatients in a hospital, or voice recognition, or any other type of biometric data capture. And then we have data management, data warehousing, so having an enterprise area where you may have one data warehouse, or you may have a data warehouse that is made up of databases that are across the enterprise, but together they come together as a conceptual data warehouse. Data marts, which are sort of like mini data warehouses for specific functions or groups of people in an organization. Then you have master data management, so making sure that you have consistency for your data. So in an organization, there should only be one record for each employee. Employee's name should not be John Smith in one system, Jonathan Smith in another system, and the nickname Jack Smith in another system. And then data modeling, so actually determining how you want your data to be stored within your data warehouse and database systems. So let's take a look at evaluating methods of data capture and data management. So for data capture, when you're looking at evaluating the method for data entry, this is in a function where you want to have a qualified person entering the data, whether it's through a keyboard or through voice recognition. For example, in a hospital setting, even though we do have ability for patients to capture their own data at home, maybe through apps, and get that added into a medical record, when it comes to the actual electronic medical record, a qualified person should be entering that data into the EMR or EHR. Whether it's the clinician themselves, a doctor or nurse, or respiratory therapist or any other type of clinician, or a scribe, that would be a qualified person. And then barcodes. Many times these are needed when speed and accuracy are important. So just being able to quickly scan a barcode on medication, or a barcode on a employee's badge, or a patient's bracelet, or a visitor's name tag, to be able to get more information out of that. And then a systematic feed, where you need to be able to capture data, but that data is coming from another system. So typically with big data. And then data management, really today in healthcare, many places are going to having a dedicated chief data officer and a data warehouse or enterprise information management team. Many times these used to be called a decision support team, but over the past 5 or so years, this is changing. There should be dedicated policies and procedures for data management that should be up to date, a governance system in place, role-based permissions to different systems. The data should be classified at appropriate levels, and there should be cybersecurity involvement as well. And so when you're looking at vendors, because you want to bring in some type of new data system, most, if not all systems involve data. It's not just about the bright shiny object of this new system and how it can do things quickly, and maybe you can, you think you can have competitive advantage, or it will cost less, for labor costs. Those are important things, but you really need to look at these data management issues as well and evaluate how that would work with your new system or vendor. So Gartner, which is a leader in helping organizations determine what they should do when they're looking at new systems, says that digital business initiatives need smart information principles to drive right-sized governance for achieving business objectives. So SMART stands for specific, measurable, attainable, relevant, and the T would be for timely. So there should be some type of time base in that metric. And so right now, many healthcare organizations have poor data literacy. Data initiatives are spread out, and sometimes they're in silos in many organizations. So what Gartner recommends is to start with the business outcomes. What does the business want to do? If we don't start with the business outcomes, then how do we really know that this data initiative is going to add value? Information principles are like the big rules that relate to the creation and use of information. They must be followed by the whole organization. They must be commonly understood, practical, and unequivocal. There can be no ambiguity among the classifications of data. Somebody should not look at a policy or a procedure and say, well, I'm not really sure how to read this and what I'm supposed to do. They must define what is and what is not acceptable regarding the use of information. So it's not a guideline, it's a rule. So one example would be an insurance company establishes an information principle stating only sanctioned sources of party master data will be used for active customers and prospects in business operations. And so that is a SMART principle. And when we talk about timely, it doesn't mean that you're necessarily going to see a date in that statement, but what you do see is that it's time-based by the use of active customers. So evaluation for data collection, data management, follow best practices, review sources, qualified sources such as Gartner or the Data Warehouse Institute reports. Evaluate all vendors with the same set of criteria. What works for one organization may not work for yours, or it may. It's always good to go out and do reference checks on vendors, but just because one organization said that this vendor or product really worked well for them, it doesn't mean that it will work for your organization. You really need to look at what does your organizational climate look like, what's the culture like, what are the politics like, what are the different systems that you have in your organization that may work or may not work with this new product. Stay away from bright shiny objects. Everything looks really cool when salespeople present it. A lot of money is spent on marketing, but even the best system is not going to work right if you don't have the foundation to support it. Make sure the organization is ready and has the proper culture, infrastructure, and governance foundation in place. So in summary, understand the needs of the stakeholders and the workflow when it comes to data collection. Data should be classified as only one type of data at a time. For example, the data can be confidential and at a later time become public, but it can't be both at the same time. Policy and procedure should support the data classification. You never want to be in a situation where some random IT person says, oh, you can't do this because I don't think you should do it. Everything should be supported by policy and procedure. It also helps the employees in an organization, especially in a health informatics or health information management area, be able to say no to somebody. If there needs to be an exception to the policy, that should actually be built into the policy and procedure and not be an afterthought. Hold vendors accountable. Too many data breaches occur due to lack of vendor vetting, governance, and oversight. For next week, we have Module 9, and you may proceed to Week 5, Module 9 after completing all of the Week 4 Canvas readings and assignments. Thank you.